Hi, my name is Olga. I'm going to be demonstrating the intradermal injection today. So in the appropriate scrubs and badge and sneakers, everything is good. Today for this procedure, I'm going to have my clean gloves. I have my cotton balls. I have my 2 alcohol wipes, and I also have my needle and syringe. In this case, it should be 29 to 30 needle, and the needle is 1/2, and it is 1 milliliters, 1 milliliter syringe. And at this case, I'm just going to be using this one because that's the only one that we have in our kit. And I also have my tuberculosis purified protein Dervidin. This is my medication. Okay, so first I'm going to look in the ER, identify the patient's order. I'm going to go over the 6 rights of medication. The first one is right patient, right drug, right dosage, right time, right route, and right documentation. Next, I will check to make sure that in the EHR that this is the correct dose. That's the first time I'm checking to verify. Next, I'm going to gather all my supplies. I'm going to enter the patient's room. I'm going to close for privacy to avoid HIPAA violation. I will place my supplies on a clean, dry surface. I have all my supplies here, and I will introduce myself to the patient. Hi, Miss Smith. My name is Olga. Can you please identify your first name and your date of birth, please? Okay, perfect. I'm gonna check her wristband. I'm gonna make sure that I have 2 identifications. All right, Miss Smith. So today, your doctor has ordered you an injection. Before I go over that, I would like to ask you, do you have any allergies, any seasonal allergies, any medication allergies, or any food allergies? No? Okay, we are good to go. So today, your doctor has prescribed you a PPD, a tuberculosis test. This is the injection that we are going to inject underneath your skin. This is to check to see if you're immune to tuberculosis, or if you have it in your system, if your body is able to be immune to it. Some of the side effects would be slightly burning, slightly stinginess, or any pain. Also, I'll go over some of the adverse reaction. If you have any adverse reactions, please let us know as soon as possible. That could include blurry vision, that could be any numbness in your arms that can occur, that could be vomiting, or any bleeding, severe bleeding. Please let us know. Okay, Miss Smith, do you have any questions for me? Okay, no questions. All right, so now we will get ready with your procedure. I'm gonna wash my hands. I will apply clean gloves. So first, I'm going to remove the cap of my medication, and I'm gonna grab a alcohol wipe, and we're going to make sure that we do wipe it. I'm gonna let it air dry, and I'm not gonna touch it. Next, we're gonna open up our syringe, and I will hold it up as a pencil. Our doctor has prescribed the patient 0.1 milliliters, so I will hold it up, and I will make sure that I put in some air, and we're gonna check again in the EHR, make sure that this is the correct dose. So I'm going to put an air 0.1, and I will show you guys 0.1. Okay, next I'm going to take off my cap and I'm going to inject the air in my medication vial. I'm going to make sure I don't touch anything in the medication. I'm going to inject the air. I'm going to slowly raise up my medication, and I will draw up 0.1 milliliters. All right. I will also do the one step putting on my cap. All right, my cap is on, and I have 0.1 milliliters. I do have some bubbles, so I will redo this. I'll raise it up. Perfect. Okay. So here, for patient safety, I want to make sure that I have 0.1. There we go. We have 0.1. Okay. So my next step is going to be that I will locate the site. I'm gonna place my hand. This is the patient's arm. This is the hand, and this is the elbow. So I'm gonna locate the site by placing my 2 to 3 fingers, by grabbing the wrist and grabbing 2 inches, putting in place in my hand the 2 inches of where the antibiotical, where the elbow is. Okay, I'm going to make sure that I inspect the site. I want to make sure that there's no discoloration, there's no lesions, and I will check for tenderness. I'm going to palpate. Do you have any pain? No tenderness? Okay, great. Okay, so as I found my site, I am going to make sure that I take my alcohol wipe and I start from the center and I go out from the center to the inside. So it's going to be 2 to 5, it's going to be 2 inches, 5 to 5 inches. So I'm going to start in the middle, going out. All right, I'm going to let that air dry. All right, Nadim, are you feeling good? Do you have any questions before we start your injection? No? Okay, so before I'm gonna inject here, you're gonna feel a little poke, and you will feel a little burning, as we mentioned that in the beginning. I'm gonna take it off. I'm gonna make sure that my bevel barrel is straight. I'm going to take my non-dominant hand with my fingers and my thumb. I'm going to pull the skin at a 5 to 15 degree angle. I'm going to go in 3 milliliters into the skin. I'm going to inject slowly until I see a mosquito, but it's gonna be 6 to 10 milliliters. I'm going to pull out, and I will place my gauze. I will take my needle. I'm gonna put in my Sharps Biohazard. I will not cap, and I will discard. I will take off, discard that. I'm gonna place a band-aid if needed, and I will take off my gloves. I'm gonna put everything away. I'm gonna take off my gloves, and I will wash my gloves, and I will document this procedure.